record. Okay, so hopefully everyone took a minute to type into the chat your name and if your organization, if applicable, and your email. So we're going to
Do we
go.
want to take a minute to, I think we have 7 other people on the call. Should we just do a minute and if they want to unmute? Because I know Amy and I host different events and we have a collaborative conversation that is very participant led and it's very like partner led. And these events feel a little bit different, but it's kind of nice to know who's on the call anyway, especially I see some new faces.
Yeah, that would be great.
So if you wouldn't mind, if you feel comfortable unmuting yourself and introducing yourself with your name, your agency, your role, or whatever is applicable in that arena.
My name is Nicole Baker. I'm the Aging and Adult Services Manager at Region 2 Area Agency on Aging. Good morning.
Good morning, Nicole.
Bill Rail, President, Jackson Area Manufacturers Association.
Morning.
Martha York with Region 2 Area Agency on Aging. I work with Nicole and we're both on our DEI committee there as well. And I also facilitate the cross-cultural conversations workshops for the community.
Good morning, Martha.
Good morning, I'm Jessica Bammer. I work for Lifeways as the Supervisor of Community Health and Wellness.
Morning.
Adam Grant, I work for Home and New Vision and I'm the Jackson Area Recovery Community Coordinator.
Morning, Adam.
I'm Mary Grace Fries. I just finished my first year at the University of Michigan MPH program. I work in contact tracing for the university and then have an internship with the Washtenaw County Health Department.
Welcome.
Hi, I'm Alexandria Fidowa. I work for Jackson County DHHS. I do foster care and CPS.
Good morning.
Great. Anyone else we missed? Great to have you all here. It's always fun, cool to see faces that we've seen before and also new people that maybe we haven't interacted with before. So, and also please feel free as Amy and I go along to unmute or chat or raise your hand or whatever to ask a question or ask for clarification as we go. We certainly want this to be interactive. I think Amy's sharing screen, so I'll do my best to keep an eye on chat and faces. I'll be seeing, oh, Adam looks confused. Let's stop here. Yeah, just kidding. I won't do that. But yeah, please feel free to speak up if something needs more clarification, and then we'll move forward.
All right, so a little overview of what we're going to be talking about today. So today's goals are that folks gain a better understanding of the shared root causes that our network has that really go beyond the sector-based problem solving. So for many years, we talked about all of the things that happened in health or education or finance. And we're going to talk today about the 14 root causes that the network has identified that really kind of go across no matter what realm you're working in. So we'll talk a little bit about those. The second thing we're going to try to impart is really understanding the differences between the symptoms of a problem and the root causes of a problem. So often programs or interventions have really addressed symptoms of what we're seeing in the community. And we're going to look at kind of getting into those deeper root causes. And the last thing we're going to talk about is how to take action by joining some of our affinity groups. We have a new partner profile page we'll be talking about, and how that will morph into affinity groups where we can move to action in those groups. That's a little bit of an overview.
Just a quick note, it looks like Shelly Milligan is having some signal issues, but their audio is on. So welcome, Shelly. Thanks for joining us today.
Okay.
So this is, a quick summary of collective impact. So this is the framework that the network uses. And I know this is like a lot of words on a slide, but essentially it's just a way of organizing and aligning work when you have a lot of partners and you have a lot of organizations and a lot of great people doing work in different parts of a community or a state or a country or whatever. And a collective impact model is finding a way to bring everyone together around shared goals and priorities. So Jackson Collaborative Network works in a collective impact model. This means that we have all decided together that we think this work will be done better, have a bigger impact, all these things if we do it together. And usually that means that it's maybe a little messier. There might be some not compromise, but like instead of like I have to have this goal, actually it would make sense if I changed my language and aligned it here. And so here are some of the elements of successful collective impact work. A common agenda, so everyone in the network, we'll talk about it a little bit later, really aligns work around 14 root causes. So like, what are the things that are really the issues? What are the big things that Jackson residents and partners have said that these are the things that we're going to work around? We have a shared measurement system, which means that all partners agree to track and report progress in the same way. So if, sorry, I turned my people off and it distracts me. So if Jessica is working over on this side and maybe tracking number of foster care youth that are seeing a counselor, and Bill is tracking something over here, we can find a way to make sure that we're tracking it in a ways that we're all moving the needle towards trying to remedy inequitable policies, something like that. Those are made up examples, but like, how do we do this together to show that the work I'm doing in this corner and the work you're doing in this corner actually will move the needle? So we have to come together in these spaces and we have to find ways to gather that can connect over things. And so these are the things that we're going to talk about today, root causes, and also we'll talk a little bit later about affinity groups, how we are gathering around together around these really big issues and what we're each doing in our organizations to move the needle together. Mutually reinforcing activities. That is really, again, like also communicating what you're doing. So it's really helpful. I think the partner profile page is helpful to know like what people are doing, coordinating and aligning the collective efforts of all the partners in alignment with a common agenda. So if I know the goals and objectives of the network, if I know what everyone's doing, then I know that Bill is working on this thing over here. And actually that could be helpful because I can connect with him and find out how my work might benefit, or I might learn a lesson from something he's done. That falls in line with continuous communication. We really are working hard on building trust and relationships among participants, which is a little bit challenging in a virtual land, but it feels like we're gaining some momentum around connecting spaces so that we can build trust and relationship as we do the work together. And then another key part of collective impact work is a backbone infrastructure. So that is part of the work that Amy and I do. We are part of the backbone team that supports all of the work that you do. So we are not ever the experts in fixing the community or coming in and telling you what you should or shouldn't do. We really serve as support people, along with Tracy and Alexa and Sherry, obviously, on helping you all do your work better and more aligned and more together, and creating spaces for you to do that well, and then maybe helping facilitate conversations, providing tools for you along the way. So we serve as support people in the collective impact work. And that's a lot of the words. I really love this work. You might be able to tell. I get a little bit, I think that was supposed to be a brief slide. That may have been medium brief, but.
It was medium brief, but we'll let it go.
No, thanks.
We do, we get geeked about it.
I do. I do want to say good morning to Maisha. Look like she joined. Thanks for joining us, Maisha. Glad you're here today. And we'll move forward to the next slide. And we will spend a brief time here. So this is, again, part of the collective impact model is really deciding what we all agree on. So part of the Jackson Collaborative Network is we have a shared measurement system, and this really clarifies the goals because everyone is doing so many different things, and it's sometimes, I think, easy to kind of like drift off, but this work over here is good, and that actually could be a true thing. But if we can keep our like vision, values, aims, goals, like here's what we all decided that we are going to commit to, then we can align our work around these things. And then, what am I trying to say? It will create accountability for change. We can keep people like, well, I know that Adam is working on the aim around our basic needs are met. This activity lines right up with this aim. I know that Courtney's working on the we are safe. So like we have decided, the network, all of the participants, all of the community members have said, these are the things that we want to make sure are important. And it organizes us for impact. So again, this collective impact model of doing it all together, and it guides a strategy design. So you'll see in the bottom, the goals are listed around education, health status, safety, life expectancy, healthcare, decreased poverty. So those are some of the overall goals. Keep in mind, this is a really brief version. Alexa is our shared measurement system expert. But just keep this in mind as we are talking about doing the work together and why it's important to come together and really get to the root cause of things. This is our framework, and this is our model. And so we're not just saying like, we're not just throwing things. We have this in mind when we all work together.
Okay, and if you thought that was overwhelming, look at this slide. So this is a bigger picture of our shared measurement framework. And the reason we put this up is just so that you can see where the root causes kind of lie in the overall framework. Sarah talked a little bit about our values of equity, authentic engagement, and continuous learning. Those yellow, the yellow part on the second column there are really our root cause priorities and our system change targets. So that's what we're going to get into a little bit deeper and talk about today. And that's where we're really aligning work around. That's where the actual action happens. The orange is just the leading indicators. So there are things that we will be tracking and measuring to know that we're moving or making a difference with our system change targets. These are some of the leading indicators, but understand that there are lots of things that folks are doing in the community that help move the needle on some of the system change targets. So we might be measuring teen pregnancy rates or infant mortality or suicide rates, things like that. But there are many, many indicators that goes layers deep. These are just some of the leading ones, which obviously our goals are to reduce violent crime and decrease years of potential life loss. And so those blue columns really are what we're kind of trying to achieve. Obviously, with that last column, that we're healthy, we achieve full potential, resilient. So we're going to pause for a minute and ask if anyone has, I know this is a lot, but if anyone has questions on this piece before we move into talking about the root cause priorities. You can raise your hand, you can do it on screen.
I like also too, just to point out that the very left column, there are not rows because we use this framework and we use these things while embedding equity, authentic engagement, and continuous learning throughout it all. So I just wanted to point that out. And also, sometimes this chart is a little overwhelming, even for me still, because it's not an equal run across, it really is. I think for today's purpose, it's helpful to like focus on the yellow column around like, these are the root causes. And we'll talk a little bit also about how we got to that, how you all got to that, because we did not come up with this, but.
I think that actually makes more sense anyway, because most of the stuff we're talking about really isn't linear anyway. So I prefer this approach because then it doesn't make me follow a direction that doesn't make sense to me.
Right. And there are so many things when you're working on a particular root cause that they'll affect multiple leading indicators, right? So if you're building trust with community members, that will kind of crisscross it to many, many leading indicators. So, but yeah, that's a lot. So we'll kind of move along, and we can always go back to this if folks have questions as we're going along. But this just helps put things into like a big picture of the why we're focused on the root causes and how they can affect different indicators and goals. So talking a little bit about root cause, we throw a lot of lingo in the network, and we acknowledge that we have root cause, system change targets, leading indicators. There's so many terms that we're talking about. So really, this is kind of boiling down to the root cause and the system change target, because that's that yellow column that we'll be talking about today. So the root cause are really the characteristics of the system that are the key drivers or barriers to achieving the goal. So we have a goal of decreasing potential life loss. The root causes are not that they get into the deeper problems. They get beyond the symptoms of, okay, there are folks that have, I don't know, if there's a problem and you're seeing a symptom, this is actually getting deeper into why is that symptom happening? Why is this showing up visibly? And the system change target is really just kind of looking at how the system will look. It's a visionary thing if we're successful at addressing that. So we talk about, okay, the root cause is the actual barrier, the deeper barrier that folks are experiencing. The system change target is really what we're trying to achieve. How will things look if we're successful at achieving what we're doing?
So I was gonna say, I'm not sure if it's helpful or not, but to me, I would say like, so maybe a root cause could be policies and practices are for, let's say, for example, there's a local homeless shelter, or that, I don't know if that's the correct term, but, and maybe they are unable to feed people past 30 days because of a policy. And the root cause is like an inequitable policy that is directly impacting different populations. A system change target would be the visionary statement. So that would be that all Jackson residents are able to eat or have access to food equitably or whenever they would want it. So to kind of put that into perspective.
Okay. So now that we know what a root cause is, let's talk about how we identified our 14 root causes. Some folks have maybe seen this before, but I think it's always really helpful because I know folks in our network have looked at those root causes and say, where did these come from? We didn't make these up. These came from our community members. These came from our health action teams, our strategic doing teams. Much of the work that was done over the past 10 years in our network. So there were lots. Each health action team or strategic doing team reached out and really engaged community members to find out where their barriers were, what was going on. So if I was working in maternal child health, I would reach out to folks that are in that system of care to find out where their barriers were. So there were many system scans, thousands of actual statements that came from community members via survey, empathic interviews. When they called into 211, we'd ask them about really what's going on in their environment that was a barrier. And so providers gave input, partners gave input. We had medical providers that said this was a barrier to giving care, or folks that couldn't get into the offices, things like that. And then they were themed, right? They kind of boiled down to taking off the who and the what, and really what was the deeper root cause, which kind of boiled into the 14 root cause or system change target. And I'm going to give a little example of how this happens. So when we did some system scans, and these are actual ones that came up when we kind of narrowed them down, but individuals would say the SNAP benefits couldn't be used for grocery delivery. That was a symptom that they were experiencing of a deeper root cause. Medicaid reimbursement was lower than private insurers. So that was something that was, again, a symptom that was happening in our community. When they boiled both of those down, it was really more about inequitable policies. It wasn't that, it got into that deeper root cause that the action teams kind of narrowed down to. And then if you look at the bottom, so there was an unequal distribution of highly skilled teachers, and internet and technology was not accessible to low-income families. So those were in the education realm, folks, those were the symptoms that they were seeing in the community. That was what kind of bubbled to the top. And again, when you narrowed those down, it was really about inequitable distribution of services and resource. So it took off the sector-based things, it took off the education piece, the health piece, the finance piece. Some of the folks were working in the different sectors, but when it boiled down to, it was about inequitable policies and it was about unequal distribution or inequitable distribution of resources. So took both of those kind of narrowed down, and one of our root causes now, one of the 14 would be about services and policies are inequitable and disadvantage the most vulnerable population. So that's kind of, there's 14, they're not magic. We didn't kind of pull them out of nowhere, but it was thousands of system scan statements that we narrowed down and kind of tried to theme and then put into some root cause system change targets. Questions
I
on
really,
this? Yeah, go
I
ahead.
really like this. I like this slide a lot because it also gives real life examples of things that people said. But I know we've talked about it in different gatherings too, around the why, like the 5 whys kind of thing. But like, so if someone says SNAP benefits cannot be used for grocery delivery service, to me, like right away, there could be something like, oh, okay, well then like, let's get that person some money so that they can have groceries, right? And so there's like a solution, but there's actually not like, well, why is this thing happening? Well, they are using them up too quickly. Okay, well, why don't they have more money? Like there's a 5 whys piece that I think we've used before, and it's like, well, why is this thing actually happening? And then you get down to the fact that like, oh, this policy is saying that they can't have more. Or so I like this example a lot. And I also think it, to your point, Amy, of like, it shows that the previous structure of the network, while it had benefits about being sector based, like education, health, like this really shows that you can have people, someone might be working in banking and someone might be working in education, and they're actually both working on trying to make policies more equitable for disenfranchised populations in the community or underserved, and that their challenges and their actions would be more aligned than people that are doing sector-based work. I mean, there's strengths, to both, but like that is where the difference, I think, our work is going, is that it's really focused around, it doesn't matter if, maybe Mary Grace is working on the public health piece that maybe feels so disconnected from this thing, but actually it's not, because like the why piece, there's like a disparity piece. And if we get down to the why is this thing happening, we actually are working on the same thing. So anyway, I like this slide a lot.
No, and I think most folks in our in the network identified that. So I was working with, okay, well, women aren't going to their prenatal care because they're not trusting that the providers are going to give them time or answers that they need. And someone in education was like, really, we're dealing with trust issues too, because parents aren't engaging in their school because they don't trust that their teacher has their child's best interest. Or so it was boiling all of the labels and the symptoms away. It came down to a lot of the same things that folks are working on. And we've really found that when we've looked at the root causes, pretty much everyone can identify the work that they're doing in at least one, but very often multiple root causes. So when they're doing system change work, they're saying, wow, I'm seeing my work show up in so many different root causes. So if I continue to do system change work versus just a program that feeds folks that can't get delivery service, they'll find that all folks in our community members will be able to kind of piggyback off that. So.
Oh, it looks like Adam has a very philosophical example that started off as a coded chat. Adam, would you like to unmute yourself, or would you like me to interpret your message for you?
No, I knew everybody'd wonder what I put maple syrup in there for, but it's that same concept that you have to get a lot of sap and you have to boil it down. And that's what it sounds like you guys have done, is boiled it down and to manage to bring people from different segments and different sectors to have the discussions that have needed to be. Like when we talk about things like systemic racism and stuff, it seems too big an idea. When you boil it down like this, people from various sectors can be like, oh, well, I guess we do have some of that going on here.
I think.
So, yeah. Maple syrup.
Maple syrup. That's going to
From
be
now on,
tagline.
that's how I'm gonna reference it with no context. I'm just gonna walk into meetings and be like, maple syrup,
That whole shared measurement framework that that seems very overwhelming. We're just going to call it maple syrup now. I love it.
They're gonna replace that lengthy slide with just
with like a
Just a
with like
picture
a
of a syrup
picture.
jar.
Yeah. Does anyone have any other thoughts? Should we pause there and see if anyone else has any thoughts around?
Feel free to jump in. We like to hear questions. We like to hear kind of perspectives, what makes sense, what doesn't make sense.
I'll hop in just real quick.
Hi, Hannah.
Hi. Also, I'm Hannah Ball from Jackson District Library. What I super love about this process and also frame of looking at issues is how interwoven things are, because I think that's just reality. So I really like the looking at it kind of holistically. It's sort of like how a social worker would look at person in environment instead of just the single person or just the environment. It's looking at the whole reality to try to find out what do we actually need to target and how do we get down to the main cause and how will that affect all the other things. So I like the whole system thinking of this approach, and I think it's really cool.
I love it. Thanks, Hannah.
Thank you, Hannah. And I think we've already established this, Hannah and I know, but I am also a social worker, so I love that example. But I think it also brings into a good point around I think it's a benefit, right, to have different sectors working on root causes together. Because if I'm in a hospital setting working on inequitable policies, it actually like makes me feel good to know that Hannah's working on inequitable policies at the library and that Adam's doing it over here too. And then also, like, if there's a challenge, I could say, oh, just so you all know, like, I took this thing to my board today. It did not go well. And maybe Adam hasn't like, oh, that happened to me also, but I had this success. Like maybe if you frame it this way, or I think there's strength in having different perspectives. I think that having somebody with different lenses and having someone who doesn't have the same sector lens as you, right? Like it to me, that's a strength because it also brings a different angle, a different lens, and also I think brings a great diversity, but also then as we're moving the needle, we can say like, we have all of these sectors represented. We have all of these different people in the community that are all agreeing together. We're going to work on how to change inequitable policies in the community together. And then maybe even be like, hey, we're missing X person at the table. We should reach out to them. Or, hey, we're actually missing like juvenile justice. Like, does anyone have a connection? How do we get them at the table? So I don't know. This feels like the affinity groups we're developing and talking about. It feels like there's a lot of potential there for that too. I guess I could move into, this is my slide, isn't it? I'm going to go to.
It's not like I'm not going to take over if I feel like
it. But no, I think that's a great segue into this. And so these are the 14 root causes that are identified or highlighted by Jackson Collaborative Network. So the process that Amy walked through, the thousands of statements and how they were themed, and we're going to drill it down and we're going to combine them all. And so these are the 14 that like everything was not pushed into, but like kind of funneled into. So, and sometimes, and I think, right, like it's hard to find something that someone is doing in the community that really only affects one. It would be hard for me to, when you think about it, like a lot of people are doing really good work and like it would probably impact 2 or 3 root causes. Like if I'm working on something around trust and relationships, it's very possible that also I'm working on getting people's like basic needs met. So we're certainly not saying your work only can affect one root cause. It likely can affect more than one, but really we're saying together as a network that all the programs that are happening, all of the meetings you might go to, all of the relationships that are building, or you're helping people access housing, or all of these things, actually we could fit it in here somewhere. Like where could that fit? And then we're trying to organize groups around this and trying to organize and say, I know for sure that Hannah is working on this thing, and that ties right into community members and providers are knowledgeable about service systems. You know, like maybe they're there's maybe Hannah's working on a program that is increasing awareness about a program, and there's a knowledge piece, right? So these are the things that the root causes that come up that we think if people are working towards, we will move the needle on these big things.
I'm also just going to point out that these are stated as system change targets. So we often talk about inequitable policies or lack of trust. These are really stated in the strength-based way that are the outcomes that we're looking to achieve. So you'll see them flip-flop depending on which form or which framework that you're looking at, but these are stated as, positive. So we're really making, so if we solved all the world's problems, which we plan on doing very soon, that all of these 14 things would have been achieved in our community. All
Yeah,
right.
thanks for bringing that up. Does anyone have any thoughts on this before we
Well, we're gonna, we'll keep.
move? I know we're gonna engage too, right?
Yep, we're gonna get folks to open up and talk about what the work they're doing and how it works. So annotate. I don't know if any folks have been on engaged with us in the past that have done annotating, but we're gonna give this a little try. If you'll see I'm not sure it's on the top, and my screen is along the top, where you see the menu and you'll see the annotate button that looks like a little pencil. If you click on that, it will bring down the options below, and you can click on stamp. And then as you touch your screen, it will stamp on different things on the screen. You can move your mouse around and click it and it will stamp on things. Hopefully that makes sense. Jump in if you have questions, and we're going to move back to this. Go ahead, Sarah.
Yeah, so this is the, we are wondering, now that we've had the talk, a lot of talk about, well, unfortunately, Adam Grant has already moved ahead and tried to be funny. So he has already put in a yes.
Love it, Maisha. There it is.
And Maisha about arrows. You can erase your own. There is like I think there's a trash can or a delete or something. Or you can stand by all of your marks and your arrows as well. But after thinking about these, and we didn't really read each one. Community members, social networks, relationships, and environment meet their needs for social support. I like that one. That's a protective factor one. But why don't you take a couple minutes and think about work you are doing and maybe where it might fit. And it can fit in more than one bubble. And this, like Amy said, this is the strengths-based. So if the world was like, this is the thing you're working towards.
And while you're kind of reading through some of these, because I know it's a lot, be thinking about too, we'd like to hear about it. So we'd like to hear a little bit about, well, I'm doing this in the community and these are the two that I'm looking to address, or this is the one that I'm really focused on, or just be thinking about it. We're hoping that some folks can share out a little bit about the work that they're doing and how that addresses some of these root cause or system change targets. I love this. It's all so colorful now. And as we talked about before, sometimes I'll be looking at someone's work and I'm like, wow, this really hits this and it really affects this and it changes, knowledge about service systems, and it's an evidence program and it makes it easier to navigate. And so often folks will be like, well, I'm really addressing 14, which actually is sometimes true. But when we'll ask to share out, be thinking about maybe the prioritized one that you feel like it's really impacting.
I also think it's really neat when we do this to see which root causes kind of gather the most like stamps or clusters or ideas, and I always have, I don't know, I just always think that's interesting.
And feel free, if you have a question on what that means, what a particular root cause means, feel free to unmute and ask about that too, and we'll kind of get into it. So Sarah, I'm thinking we can actually read out the root cause and then see who stamped on that particular one.
Yeah, sure. Or if someone wants to, yeah. Well, we could start with, I will say the services and policies are equitable, excuse me, are equitable and benefit the most vulnerable populations has at least 5 marks. So I'm wondering if anyone would feel comfortable commenting or unmuting or giving thoughts about any work you're doing or why you chose that one.
I don't want to be the only one who speaks, but I will.
We'll take it.
We're doing an event on Saturday called Recovery in Our Backyard. And we're doing it at the King Center. And one of the things that we're trying to do is get the message out there verbally, visually, however we possibly can, that we're serious about better representation of populations that have been underrepresented and underserved in the substance use disorder field and the recovery field. And one of the ways we found to do that is instead of just telling everybody where we are and what services we provide, we want to start showing up. And one of the things that inspired us was the mobile recovery unit, the idea that they kind of show up where they're needed. And so this is one of the ways that we want to do this, by listening and giving people a forum and an opportunity to tell us what we're doing right and what we're doing wrong. And then hopefully working with us to make the system better. So that's what we're working on right now. One of many things, but that's the main thing we're working on right now. And again, that's Saturday at the King Center from 11 to 2.
Adam, I wonder if you checked any other root causes.
Yes, I checked providers and organizations. The third one on the top, everyone's in a respectful and equitable manner. Community members are adequately involved in design or administration of policies. And I did another one. I don't think I did, but I should have put improved trust between community members and service providers.
That's
That's
excellent.
great.
And I love the way, Adam, that your first step in trying to address the problem, so you find out your problem, your first step was community engagement, was getting in and hearing the voices of those that are most affected by the problem. And so that's an amazing first thing. And I love the work that you're doing. So you're going to listen, you're going to hear with open ears, you're going to find out where their barriers are. And then the statements that you hear from the folks that are coming to the King Center will probably be really about, well, it's about lack of trust. It's about the service system is really difficult to navigate. I mean, you'll be able to really identify with probably many in the voices that you're hearing. So that's awesome.
And I like how it touches on more than one root cause, right? And those are, I mean, not the norm, but I think it's it could be very normal to have work you're doing hit on multiple root causes. And yeah, I think that's great. Does anyone else have any other examples they'd like to share or thoughts on why they chose one root cause?
I'll jump in. So we've kind of gone down a bit of this journey ourselves as well, the Jackson Area Manufacturers Association. I mean, primarily, we provide skill trades training for adults and career exploration and skill building for young people. And so we've struggled for a number of years with having, we built our entire program on the career exploration and skill building initially around raising awareness for students and giving them opportunities to interface and connect with the Jackson Area Career Center and the programs that are out there, and getting them the skill sets that they kind of need to be able to go out to the Career Center and hit the ground running. And, you know, years into the work, we're seeing no or very small number of kids from the urban core coming out to the Career Center. So we started to have some conversations and going out into the community and talking with parents and students and promoting the Career Center and bringing some programming to the mix. And still, you know, the numbers weren't really moving. we even came to the point where we started to build some programming in partnership with the Jackson Pathways folks to bring our programs right into the classroom. And the kids were underwhelmed, to say the least. They just didn't really see the point, I think, of what we were trying to do. We thought we had the answer, right? Even just us sitting down with the teachers. Well, we've rebooted all of that. We threw it out. So even just going to them, bringing the programs to them, that's not necessarily the answer either. So in working with the students and working with the leadership and really taking a totally different approach and coming back to the table with no preconceived concepts or plans or programs to deliver, we're starting to rebuild what we're doing with not just Jackson Pathways, but the larger community and a number of other community organizations around building programs from their perspective rather than ours. And it's a work in progress, and we'll see where it goes. But I'm very optimistic that at least we're on the right track now. And we've made practically every mistake I think you could make in the process. But we're learning from it, and we haven't given up, and that's what's important ultimately. We'll get there.
That's awesome, Bill. And I don't know that they're mistakes. It's trial and error, right? Sometimes
Yeah.
you got to throw stuff out and see what sticks. And the fact that you keep revisiting it and don't just continue along that path is that, I mean, that's the amazing thing.
Well,
And so
I call that data collecting, actually.
yeah, it's not it's not a failure and it's not a mistake per se, but you can screw this up to the point if you make enough of those mistakes, people stop paying attention. It's part of that building the trust. You can really mess up to a point where people are like, I don't trust you anymore. And it's, if you cross that line, then then it's really hard to come back.
that could be hard to come back to. But then you put the brakes on and you say, you know, we've said this so many times, folks in our community know what they need. We often are sitting behind closed doors and sitting around tables and deciding what our individuals in our community need. And we're not stopping and saying, asking. Folks know what they need, they know what their barriers are. And if they're part of the co-design of the program, which sounds like, Bill, you're really going to do that, have them be part of the design of the program, fingers crossed, it'll be successful.
Adam, you
And
have a
I
question?
think when we have a human, a person-centered approach to all this, it changes too, because when we stop approaching it like a problem to be fixed and realize that human beings are never fixed, they're healed, then we understand that one of the things it's going to take is time and consistency, because there's a generational thing that's going on in some of these areas that we're talking about. We're not going to fix them in 2021. We have to keep showing up. We have to keep showing that we're willing to be vulnerable and take a hit, because quite frankly, other people haven't had a choice. It's one of the discussions that I've been having with a lot of people lately when you start talking about things like white privilege and things. Yeah, they're in the back. Is the fact that I have a choice into some discussions and things that I inject myself into, and I do that on purpose into uncomfortable conversations. Some people are born into it and don't have a choice. And so if we keep showing up, if we give time and we give consistency, I believe the trust will start to build just as it deteriorated over a period of time.
That's great. Thank you for that input. Bill, can I ask you which root causes you chose, or root cause? I shouldn't assume more than one.
Yeah, our primary one is the community members have skills and assets and agency to get their needs met. Obviously, I mean, what we're doing is more focused towards occupational and career, right? But it's part of the wheelhouse if you don't have a steady job. And you need the skills and assets to be able to get those. And even more narrowly, we focus in the manufacturing world, because that's, that's my domain, if you will. My board doesn't let me go off into healthcare. And then sort of related to that, the existing services are affordable to the community members that need them, because if we're providing training, but nobody can afford to take that training or access those resources, then what's the point? And then the service systems are easier to navigate. And that's both from an employee or a participant perspective and the employer perspective. We manage registered U.S. Department of Labor certified registered apprenticeships on behalf of about 60 manufacturers in our community. primarily because for the small to mid-sized manufacturers, they don't have the internal resources to be able to pull that off. It's complicated to some respect, and they don't want to deal with it. And it's, you know, they got to interface with the government, and they have to come in and do stuff. And so the system from that perspective isn't super easy for them to navigate, which is, it's not necessarily something that you would normally think about as part of the ecosystem, but the employers have problems with navigating some of those systems that would allow them to provide these programs to people, which can help them get into a high-paying career.
No, thanks for sharing that. I think that's great, and similar, kind of echoing Amy's comments. I love that really both you and Adam talked about when you were describing your process, Bill. I was struck by the humility in which how you were approaching things. And Amy and I talk about this often, and I feel like in order for good systems work to happen, you have to kind of check your ego a bit, because I think, like, right, many of us, I am a like white middle class educated woman, and I was even told in grad school that I know the answers, right? So these things about like how I show up in spaces and what I am assuming or bringing to the table, and also like how much of that can I check and like own and be like, I would just like to acknowledge that I was very wrong about this thing. I thought I had a thing in mind, and that was not correct. So I just really was struck by that, and I want to like highlight like humility, because I think that we all have good intentions, and then also realizing like, oh crap, I also brought this to the table, like here I am, you know. So I really appreciate that you talked about that, because I think it's important to this work as we do it. Would anyone else like to share thoughts around work you're doing, or where you put a stamp, or if you have a question, or if actually maybe this is confusing?
I'll hop in again just for a second. I'm fairly newish in the position that I'm in. It was initially set up to be a social work position, and I'm not a social worker, though I am looking to pursue that. So it's been very interesting I'm in the community engagement department. I'm the community services coordinator. So I try to find organizations that have services or resources that would help the patrons we see that the library doesn't provide. So it's a very unique and new role for a library. It's a newer role. So it's interesting reading through these, because a lot of them hang a little bit on what my role is. And since I'm fairly new to it, it's been a huge learning curve of what groups are already out there. What are the organizations? Hey, what are the needs? You know, and how do I keep all the staff informed so that no matter what branch someone goes into, they'll have access to the same resources and the same information. So it's been really exciting. And it's super nice to have these all just laid out for me. It's like, oh yes, that is what I'm doing. Thank you for putting that into words nicely.
That's how we're going to solve that problem, right?
Yes, it's super helpful. So it's very exciting. It's also interesting, speaking of race, because I am also white, and I am the only white person in my department out of like 6 of us. So that's pretty neat, especially since it's the community engagement department, and Jackson is not all white. But it also adds a level of weirdness for me as I look for different needs, because I haven't personally bumped into some needs that other people might have, or different experiences that other people might have, or this resource might work great for some people and not for others. And so then, will I even find out that it's a barrier for some people or not? And I thought I had this issue checked off, but actually it doesn't work for this other group. So now I gotta, try to figure it out there. So it's all very interesting and very exciting.
That's great. Thanks for sharing, Hannah. And hopefully, I know after we move past these slides, we have ideas and intentions of gathering groups around these root causes, so that if these overlap with your position, or we're hoping it overlaps with many people's positions, and like we get a lot of people that want to come and gather around these things, so that if like, for example, I was definitely certain in a previous role that like putting up flyers in like a certain part of town was going to be a great way to like advertise about a program, and I was quickly checked and like, that's who did you ask? Like, that's not a, right? So there's a piece in there too about like, as we bring people together around these root causes, we have those discussions and talk about like ways to communicate or engagement, and where we're all participating and listening and talking about the same thing. So thank you for sharing.
Anyone else
Anyone
want?
else?
Yeah,
Melissa?
want to, something they might have stamped, something they feel like they want to start stamping as they move their work along. Awesome. All right, we can move on. I mean, I think it's really interesting too, the fact that as we talk about the different, some system change work will address different root causes or system change targets. When we're working with folks doing action planning in the network, and they have their problem statement, you'll have different strategies that will address each one. So you might be working on engaging folks in a certain thing, and you might have a strategy that really is designed to address it, system services are easier to navigate, and a completely different strategy that would be addressing that community members are knowledgeable about service systems. So yeah, I mean, although we talk about trying to prioritize one or two, you'll have different strategies that you're building that will address the different root causes. So, all right,
Oh, we have to
clear the board.
and tell people, isn't there like an X they have to hit? Otherwise we'll keep stamping the
Yes.
rest. I can
So when you-
see, yeah.
When you brought that down, the little thing, if you go to the right-hand side of that bar, that drop-down bar, there's a little red X that you have to click out of. Otherwise, we'll be stamping all the way through the presentation, which can be very fun.
Could be a fun time.
But we're going to ask you not to do that because we're going to be like, oh, start. Okay.
So we'll move forward. So this is taken from Able Change, and this is a framework that the network uses. We use a lot of their ideas, and sometimes people, myself included, have tended to gloss over sometimes when some like fancy language is used or it seems very jargony. But we really liked this slide because it really shows a difference between like a program focus and a system focus. And I do think that there are programs and things that are happening that can help lead to system change. But I just thought, like, I think this is a great example of the difference and maybe how to shift something from a program to a system. So here the program focus is isolated, uncoordinated efforts. Like maybe you're working on a program to engage parents because you actually realize that not enough parents are engaged. So like, yeah, but it's a good thing. It might be meeting the need, but it's not coordinated, it's not sustainable, it's like just a program. The program focus is a my client, emphasis on addressing immediate needs, right? And sometimes it's hard to not. We talk about this all the time because it is our role to be systems focused. And so a lot of times people are like, yes, but I'm on the ground doing this work. Like, please don't stop that. Like, we need people on the ground doing the work. And also we have to change the system. It's always a both and. So if you're just doing programs without thinking about systems, the programs are just going to be like program forever and never change a system. The program focus could be program improvement and expansion and like an isolated learning. So again, like programs are helpful and they are important to meeting a need, but we also want to just show the difference between that and a system. So the systems focus is when you're interdependent and interconnected. So even if you have like a program that's working well, maybe you reach out to another school or whoever that's doing a parent engagement or family engagement program and saying like, hey, have you had this issue? Like, how are you? Oh my gosh. Oh, you have this policy too? Oh my gosh. Well, then how do we like connect? How do we do this thing together? And then it turns into our clients and our partner pieces. They're really, I think it goes back to the ego check thing too. Again, understanding that maybe Bill is doing something that I hadn't even thought about. Like, oh my gosh, that's brilliant. Like that is, what a great idea. These are our people, right? Like our community members, we should all care about them. There's an emphasis on solving entrenched problems by targeting root causes. That is why we're all here today. Instead of like, not just, yes, we need families to be fed. Absolutely. Like, please, we need to feed our families and like that is, and get people housing. These are such important problems that we should absolutely address. And also, why are so many people, why is this specific part of the population experiencing homelessness more than another? I think we should talk about that. I think we should talk like, oh, there's a policy that is in place that prevents young moms with kids from getting housing. Oh my gosh, well, how do we address that, right? There's always a why. And so that is, I think, why we're here today to talk about, we absolutely are not against programs, and we absolutely, it's so important to have people on the ground doing the work. And also, how do we at the same time talk about why are all these things happening? Like why not just, we need a both and. With a system focus, there will be a system transformation, right? It's not just program improvement or like writing a grant. Lord, I've written so many like program grants for like, I need more funding for 6 more months, please, you know, because if we can transform a system, then we have shown that like this thing will be sustainable. We have shown that there's a different value, that we value different things, and that it's time to like treat our humans better, to value the humans differently. And then instead of isolated learning, it really is around shared feedback and learning. And we come to this piece again around collaboration. And if we're all coming together around this thing, we have agreed that what I'm doing in this corner of the community, I have some expertise and I have some challenges, and maybe they're different than yours, and we can learn from each other. And I'm going to trust that this space is going to move us farther than me just doing it by myself. And we come back to that, I think, the checking the ego piece, and really thinking that together we will move the needle better.
Yeah, I love your focus on the checking the ego piece. And I love that you're saying programs are important, but, and I've seen this so often in our community when there's been a barrier and people will use the transportation is the barrier. So let's go buy a bus and we'll pick up uh, the patients and bring them to their medical appointments because it's transportation's the barrier. And that's where moving from that program of like paying for the bus and then the bus breaks down and you got to get grant funding to buy another bus, and it's having those difficult conversations when you're focusing on the root causes that can feel uncomfortable and needs to be uncomfortable. So it's going beyond using and we use it as an excuse, right? We are like, transportation, that's why women can't get to the prenatal appointments, and stopping and saying, now maybe it's something more than transportation. What's going on in that woman's life with chaos and with her not being able to afford a car, or the bus system that can't get her there because there's policies against bringing her children on the bus, or having those uncomfortable, deeper conversation, which will then help change the system so that the bus policy changes so that she can bring her 3 children and she has, earns a living wage so that she can have her consumer's energy bill paid so that she has light and doesn't miss the bus because the alarm didn't go off. It gets into the social chaos of that individual's life, but it gets uncomfortable. The system focused, we tend not to do it because it's easier to talk about a symptom. Well, it's they didn't have a car, or they didn't have a bus route, or it's easier to focus on the symptom than the deeper thing.
Well, and I think Amy brings up a good point, and that it's very messy. It's certainly not going to be solved in a meeting. And often I think that it's easy for us to put blame on individuals, or like a thing, right? So if we use Amy's example of like why this young mom isn't making her prenatal appointments, it's like, well, gosh, like, isn't she responsible, or isn't she whatever? Instead of actually looking at the root cause of things and all of the systems in place that have likely failed her or have been built to oppress her. And so there are pieces in there of like, if we move to the systems piece, there's also a piece in there that like we probably should own, like, oh gosh, I'm part of the system too, that like is really not built to help her. How can I help shift this? It really moves it. It's messy. It is like this work we will do together, we will be doing for a long time together, because it really is messy. And you might think it's one thing, like Amy said, like, well, obviously she needs to be better organized, because then she would be able to get on the bus, when like actually if we dig deep we realize that the onus is on other pieces and it is on other parts, and we can do that, but then we also have to like acknowledge that there are bigger systems in play, and are we willing to take that data and make a change? Because I'm here to like gather data that might be uncomfortable, so that we can all make the change together, even if that data means that like, oh, actually, Sarah, you thought you were doing something helpful and that's actually not helpful.
All right, we're going to get into.
Anyone have any thoughts
example.
there before we go? We'll
Nope.
move. I like this slide a lot. I think we
I do
should
too.
bookmark in it. So just a quick example, I think that we've done a good job too, talking a little bit about examples. If we bring up the problem of like students who are in school needing to be connected, excuse me, to mental health services, we just bring up, that's our problem, that's what's coming up. An easy solution would be like, right, schools are trying to refer people out to different mental health organizations. And so if I see a student, I know like, if I see a student at Da Vinci and I refer them to Lifeways, there's a Lifeway process, and there's a form I have to fill out, and there's all these things. And there's like a lot of processes, and there's a lot of, and so we wrote the drawback. This is kind of an example. I have my toes dipped a little bit in the whole child work group, so I think they are working on something like this, but we thought it would be a good example of like the drawback of each school having its own form, each provider having their own form. The service system is really tough to navigate. No one knows what form to use for what provider. Am I using this form? There are people that are sending forms back saying you didn't sign this correct. Students are slipping through the cracks, they're not being seen. And if we look to a system change effort, this is something that the whole child group is working on. They're working on a universal form that can be used by all schools, and that all mental health providers would agree to use, so that they're considering them our students. It's not like this is a Da Vinci student and I need to make sure that I have a Da Vinci form or a Northwest form. It takes a little bit more work, because each provider has to be contacted. Lifeways, do you agree with this form? Okay, well, what processes do you have to go through? But it really changes how the system works. It increases communication and trust between providers and school systems. All the providers and schools are on the same board. They're on input and design. I was a part of that, where one of the healthcare providers was like, no, actually, we need the HIPAA thing to say this. Yes, we all agree, right? There's shared feedback and learning, and there's like a new system that is happening because of this. So instead of like just saying, yeah, we're going to get this one student's needs met, they're all agreeing, and it's messier and it takes longer, and it is feels a little muddy, but in the end, there's a different system now. So all of the schools are on board with this one form, and all of the providers are like, yes, we will accept this form from any school. It has been agreed upon. And now the process is easier to navigate, and students are easier to track, and teachers and counselors, right, also have an easier way to refer students, and so to make that connection. So I don't know, I thought that was a great example of how, yes, the other one would have like met an immediate need, but actually changing the system of how students' needs are met, students' mental health needs are met. I think this is a great example of like a thing that will result in, and then in the future, we have a new mental health provider starts at Da Vinci. They're like, here's how we do mental health referrals. Like, it's done. There's a new system that has been created. So that was our example. So we'll pause here. Like, can you think of, just for an engagement, or is there an example of maybe a program that you have done that could be a system change work, or maybe that has become that? Or can you think of an example that you're working on that you're stuck in program and you're not sure? Or just if you have a general question. We don't want to just keep talking.
Keep in mind too that Sarah and I are available at any point. If you're working on a program and you feel like it's more programmatic than you want, reach out to us. We have a jacksoncollaborative.network.org website, and there's a request consultation on there. So if you get off this call and you're like, wow, I feel like what I'm doing is more programmatic and I want to change that, reach out. We can kind of help think things through, look at the process, figure out, analyzing data with you and problem statements and all that kind of thing. So,
And I do think,
Well,
oh, I'm sorry, go ahead.
oh yeah, this is Maisha. Today I'm taking taking less space and giving more so I can learn. I tend to be a talker, but since no one gave any examples, I had a really good example. I work a lot with the grassroots organization Partial to Girls, and who I'm sure everyone is aware of, but gives out, diapers and formula and basic needs bag. And traditionally from systems in Jackson, where you can get diapers and formula, you have to go through an extraneous process, whether it's through, with respect to these organizations, DAHS and even with United Way and the WIC department, right? You have to go through all this paperwork and stuff. And they have changed the system so that all you need to do is as simple as how many people are in your house, what's your zip code, and you can have access to resources. And so they've changed the system so that when people need help, they don't have to go through so much exhausting paperwork and questions. They can just really get the help that they need.
I love
That's
that
great.
example, Manisha. It's great.
We've
And-
got something that's we didn't even realize what it was going to be doing when we opened the engagement center up across the street, where it's helped to streamline some of the problems because people had been, banned from certain facilities for certain period of times for being non-compliant and things, of course, when they're in the midst of their addictions. And so the engagement center is made for an opportunity for them to be able to demonstrate compliance and for people to be able to more adequately advocate for them in a way that they haven't been able to do. And then hopefully this will transfer into more of, not just like you said, not just of a program nature, but we can kind of bleed over into other things. It was interesting that Sarah was showing that slide. I was just talking to the panel that's going to be talking at our event on Saturday, and that was exactly what we were talking about, is finding a way so that you don't have a person who has to do one set of paperwork here and then you hand them off and then they've got to start the whole process over again. And they might not have all the information. They were calling it a warm handoff. And I even added seamless to it, because most of the information we're gathering is the same. So if we can find a way to have a system-wide acceptable standard, we have less siloing and we have less, territory, going on. So I appreciate everything you guys are doing.
It's interesting that the examples that have been given and the example that I just used randomly are all about services and processes being easy to navigate, right? Like I thought that was interesting. It almost sounds like we could create a group from that. Anyone else have any thoughts or ideas?
I'll provide another example. And again, it's a continuing work in progress for us. For you guys to understand what I'm going to say and how it relates to being a system change, you have to understand how the current system kind of works. So we've got and the project we're doing right now is a 5-county project, but we really started here in Jackson with the Jackson Area Career Center, and only now are we getting to the point where we can implement this thing. Um, the way the system currently works, you know, whether if you get to come out to the Jackson Area Career Center, which not every kid gets to do, and there are some programs at some of the local high schools, but there's a limited number of seats for kids out at the Career Center. So you get out to the Career Center and you get into the manufacturing program, whether it's machining, welding, or engineering, and you learn a skill set, and you get some work-based learning opportunities potentially, and then you graduate and you're out the door, and it's up to you to go figure out what to do next. I mean, there's some opportunities for some college credit here or whatever, but we focus on registered apprenticeship and employment. So it's left up to the students to figure out what to do next, if you will. And if they're lucky enough, they can get hired by a company that might do an apprenticeship, and then they might get put into a training program. And so we've been working on restructuring the way this happens so that the actual apprenticeship is embedded right into the high school programming. And not only at the career centers, but also at local schools that have related programs, so that we're able to track, report, and count all of the learning in-class learning opportunities and the work-based learning experiences, whether that's job shadowing, internships, paid work. And we're intentionally embedding more and more of those higher order function opportunities into that student's experience as they go through the process, so that ultimately, and we're really hopeful that within the next year to year and a half, we're going to have a system in place where the vast majority of these kids have the ability to actually earn a U.S. Department of Labor certificate of completion when they graduate from high school, which is the equivalent in the industry, in the manufacturing world, to having a 4-year degree in something. So whether it's welding or machining, or, you know, for us as entry-level technicians, to get you in the door, that could then lead to these other higher paying careers as well. It's a work in progress, but we've got a grant from the state to help fund this work, and we are really optimistic. We've got all the right players at the table to make this happen and to realign what everybody is doing, so that even across the 5-county region, all of these programs are building on the same competencies that the employers say they need in order to have a highly skilled person. So when they come knocking on the door, if you will, that they could get hired. And we're trying to even take the door off the hinges and bring the door right into the classroom, so that those kids are interconnected with those employers from the very beginning.
Love it. Thank you for sharing that. Good stuff.
That's great. Well, let's move along. I know we want to talk about I feel like we've talked for an hour about our affinity groups and that, and our partner profile page. We do. We're like planting the seeds, and it's all about to come to fruition.
Okay.
So go for it, Amy.
Yeah. So some of you are familiar with this. We have rolled this out in the last month, and we are really asking folks to engage in this partner profile page. This is how we're going to rally and organize in our community, right? So look, Bill, you're a celebrity, you're on here already. So so this is the partner profile page. You can go to our website and connect right to this page. And you can look at what everyone else is doing in the community. So you can, on this left-hand side, where it filters, you can identify that, hey, I'm working on service systems that are difficult to navigate. You can click on that and you'll see all the folks in the community that are also looking to address that. So one, it's really a way to find out what folks in the community member are working on. When you input the information, we ask it to be system type work, right? So programs, certainly, we welcome to, you to input programs and things like that, but it's a way to connect. It's a way to find out what everyone else is doing. It's a simple form. So this is what the profile looks like. Like I said, if you go to our website, there's a partner page or partner resources along the top bar of our website. You can click on that and it'll take you to this form. So
Alexa, of course, thank you, Alexa, who joined us late, but is always on the ready with the links in the chat, has just put a link to the page if you feel very proactive and would like to keep the link handy. Thank you, Alexa.
Yes, the link is to add to your profile. I think we should all encourage everyone to do that. We would appreciate it. And then I will add a link to view all of the partner profiles.
So yes, thank you for that. And we've gotten a great response. I think this is as we've rolled it out, people are excited to find out who's doing what, because we are most effective when we can work together and build off each other's strengths, sometimes weaknesses, not often, but simple. We kept it simple. We listened. You guys came and told us what you needed and how simple it should be. So it's just entering your name and your email, and then 1 to 2 sentences about the work that you're doing in the community. Specifically, we're hoping to look at systems work or addressing inequities in our community, because really that's the focus currently. And then there's that drop down, which root cause priority are you looking to address? We looked at it on this slide here. Sarah always says there's no gold star for clicking all 14. We're not going to give out gold stars. And often it does. Often when you choose one, there's 3, 4, 5. We're asking folks narrow it down a little bit, because this is how we're going to gather in our affinity groups. If you've identified that system services are difficult to navigate, if that's one of your prioritized ones, we're going to actually pull off affinity groups moving forward. So
and we will send an email to all of you after this meeting, and we will include the link. So don't feel like this is your one chance and your one shot. We will make sure to provide links to you in the email.
We won't let you off that easy.
We will not. That's code for do it.
Yeah. So yeah, it's a simple profile page. You can search, filter it by different root causes. You can filter by organizations, agencies, things like that. And it's just really great to be able to see. So often we've gotten on these gatherings, and folks, they love to hear what's going on and what other people are doing. And we're really inspired by each other. And so I think that's a great way to kind of highlight what you're doing.
And I think, Amy, if you'll go back, I think it's just also a good point too, to like, Amy and I love to host spaces for everyone to gather, but also are very aware that not everyone, like, we want to offer a lot of different ways to connect to people. And if Bill is able to go on and say, oh my gosh, I did not know that Laura was working with this root cause, but I would really like to connect with her. Like, there's a direct connection that he can make because she has provided her email that we don't have to facilitate. If there are things that, like, there are questions, of course we are here for support. But if the goal is to provide a space to connect, for you all to connect, I think this is awesome. I think this, and it will serve a lot of purposes. We can use the data to also make affinity groups where we will facilitate conversations, but like, we don't have to be the middle people for everything. Happy to not be. If you see an opportunity for connection, that's what we're hoping.
But you do such a good job at it.
Ah, well, Adam, you're welcome to come to any of our meetings. All right, should we move?
Yes. So we talked a little bit about the partner profile page, and what we're rolling out, the next step of this is to gather around root causes. So we've talked about the 14, we've gotten a better understanding of what it means to be system focused. And now we're looking at, so that circle in the middle would become a root cause priority. So it might be services are inequitable and don't meet the needs of, I think I just combined 2 root causes, but if it's about inequitable services and policies, that would go in the center circle. And then folks that are working in that realm would, or toward that, addressing that root cause, would bring their organizational strategy to the table. So the affinity group will meet, it'll be about inequity policies and procedures or practices. Oh my gosh, okay, let me start over. But the difference is that all folks and organizations, if you've built an action plan or you're working toward addressing that, you would bring that strategy to the table, and you'd say, wow, with JAMA, we're actually instituting this to move the needle on that root cause, and bring it and talk about how, we would figure out measurements, and are we tracking and tracking progress and measuring those things. And we've had some questions in the past about how is this different, right? So we used to have a health group and an education group and a financial stability group. And we would sit at those groups, and it was sector based. So it was about health or education. And we would talk about all the problems that our community members were experiencing. And then we would come up with all of these ideas of what we're going to do to fix that. And then we went all back to work to our 9 to 5 jobs and really didn't take action, because a lot of folks don't have capacity to take on a new strategy. What we're looking to kind of shift is, you're all doing strategies that all affect these root causes, really important work in the community that can impact barriers that our community members are experiencing. So we're going to gather in a way that you bring your organizational strategy back to the table so that we can build on each other's strengths and weaknesses. We can question each other, hold each other accountable. Well, how are you measuring? You say you're doing this. How are you measuring that? How do you know? What data showed that you need to actually put this policy or change that policy? Oh, wow, you reached out, you've heard from community members, and you do have data. I should probably do the same thing in my organization. So we're excited. We're looking to roll this out in June, and I think the date is later in the on the slides. But we're excited. We're gonna pull together folks and really make impact and move to action. Right? We've been talking about this and we've been digging deep, and now we're gonna try to move to action.
I really like, Amy, how you said too, the piece around like owning what I'm doing as a network partner, the strategy that I'm working on that is tied to this root cause. And so it is, I think, easy for me, for everyone to be like, oh my gosh, I can't believe that this person over here is not doing this thing. And I really think that the way that this is moving, this is shifting, is like, what am I doing in my organization to address inequitable policies? I'm doing this thing, and this is what I have control over. And then when we meet together and Hannah's like, oh, I brought this strategy that I'm working on, and then we can talk about how they're similar or not. And then if there are people missing from the table, partners are welcome to invite others, but this is not a voluntold group. This is not a forced coercion group. This is hopefully a group that adds value, and people start like really feeling like, I'm so glad this group is here, that more people will want to join. We'll see how it unfolds. But I really like how it's structured around what people are doing, and then holding each other accountable and holding each other accountable for action. And then also measuring, like, well, how do you know you'll be successful? Like, are you measuring people that come? Are you asking them later? So this has great potential.
We're excited about it. And to Sarah's point, we keep talking about the system, and the system is broken and we need to fix the system. And we are the system, right? JAMA is the system, the library is the system, DHHS is the system. We are all pieces of that system. And until we turn into our own organization and saying, what am I doing to fix the system that I built or I am part of? That's, it's easy to go, the system's broken. We need to fix the system. We are the system, and we kind of have to boil it down to that. We all have a responsibility to look at these barriers and to make changes within our organization and not just talk about them.
So this is just a quick image. It's a little blurry. So we'll noted. All right. Well, but this is just an image we like to show, and it really, again, kind of comes back to the collective impact model around so many people are doing like this great work in the community. I have this huge world problem I'm trying to solve, and I have this huge boulder, and moving it by myself, the progress that I'm going to make is not nearly as great as if we can all come together around a root cause that we've all identified. We're all working on the same thing. I would like to carry a pebble, and then Hannah can carry a pebble, and Maisha can, and together we will move the needle in a, I feel like I said, in a less sweaty way. Then it's still difficult and messy and challenging, but it feels more doable, and it feels like more progress can be made on moving the needle on those big issues.
All for less sweaty.
That's going to be our tagline.
Maple syrup.
Maple syrup. So this is it. This is there. I wish I had a drum roll sound, but I don't. But this is our, so our first affinity group is, we are going to meet. We had a lot of people put in data already. So people have already entered information into the partner profile page, and they said the lack of trust between community members and providers is one of the top ones that people say is an issue and they're working on. So we said, okay, it sounds like a lot of people are working on this and that we should meet around it. So that is going to be our first group. We have yet to determine a name. We were thinking of like the way our system change targets are named are strength-based. So maybe like strengthening trust group or something like that. Feel free to suggest ideas if you have ideas, but this will be our first group that meets. And if you are working, if you have a strategy or strategies that are working towards building trust or repairing trust between community members and service providers, we're going to meet soon.
June.
In June. That kind of rhymes. We have it on a slide. Oh, and this is our new, we'll just do a quick, we have a new website. Our website is constantly being updated. This is a current shot of it. It's going to get even fancier, but we have a new tab called Partner Resources on our website, and it has a place where you can update your partner profile. You can create an action plan. You can contact Amy or myself if you need help with anything. It doesn't have to be specific to action planning. If you have questions on something you heard today, Alexa is putting a link to the site, of course.
I knew I was like, oh, it's going to pop up. I'm going to see that blink.
And so that's exciting. We're working on making even more resources on our website.
And always a plug for our upcoming events. So June, we will have June 8th is a collaborative conversation. That is a little different than a learning convening. We talk much less and we hear more from you all and what you're doing. And we're going to talk a little bit about, we touched on it in our last collaborative conversation of what we need from the affinity groups. And folks shared about what would be helpful and how it should be designed and things like that. So we're moving forward and we're going to be talking about naming things and who should be involved and how should that should all work out. So that's June 8th. That is more interactive, less formal, less about learning, more about talking and connecting. The 16th will be the learning convening. We're looking at rolling out our first root cause affinity group. We may be a little eager to do this, but we're hoping to bring it together to reach out to folks that have had things in their profile page. It'll be open to whoever wants to come. But again, like Sarah said, we're not going to push it. We want folks that are there because they care and they want to take action. So, and then
also keeping in mind that like, this is also something that is bubbling up and has momentum and we're going to roll with it. And we're also counting on you all to say, hey, this is a great way to support us. And actually, here's a different way that you could support us that would be helpful. So we are rolling this out based on information from you all, and we'll continue to make decisions based on the data you give.
And continue to adjust and morph and learn. So
yep.
We're all in this together. The 23rd, we're trying something new. We're going to do a coffee connection. So from 1 to 2 on the 23rd, Sarah and I will be hanging out on Zoom, drinking coffee and chit-chatting. And we are welcoming anyone that wants to jump on, that has a question about all the stuff we've talked about, that has a comment, that has suggestions, or just want to get on and share a cup of coffee and say hi. We will be hanging out the 23rd.
Don't mind. It feels, I think we may have had, this is a late night slide edit. So don't mind the 23rd and 24th. That's not correct information. We will not be on 2 days in a row, but we will send you
visit our website for more information about our upcoming events. So if you look up here, we have news and events and all of the information will be on there.
We will send you information. That is correct.
And there's our contact information. Any final thoughts, last comments?
Oh yeah, and Alexa, thank you. We will be sending you a survey as well on your experience today. So we hope you'll take a couple minutes to fill that out because that helps drive how we support you, how we talk, how we don't talk, what we talk about.
Yeah, we really welcome your input because we can only support if we know how to best support. So. Any last comments? Thank you all. I know that time is really valuable and I know that Zoom is exhausting and it's really hard to get on call after call. And so we really appreciate you joining us today. We are excited about the work that we do and we hope that we will all continue to partner together to make the world a better place, especially Jackson. All right.
Thank you.